In the College Board Provided Stimulus, the inaugural address, FDR states, "We have nothing to fear but fear itself." Many would disagree with this, as 5.6 million abortions occur in adolescents aged 15 to 19. In developing countries, over half of these pregnancies are unintended, and among those pregnancies, over 40% end in abortions. I would like to begin this discussion by discussing what is an IUD. IUD stands for intrauterine device. Yale Medicine defined the IUD as a type of long-acting reversible contraceptive, or LARC. Among the IUD, there's two different categories. There's a copper IUD as well as the progestin IUD. The progestin IUD is a hormonal IUD that is made up of levonorgestrel, which is a type of progestin, again, a hormone. So the progestin IUD can last from 3 to 5 years, depending on what brand you choose. Some popular brands are the Kyleena, the Skyla, and the Mirena. On the other hand, the other type of IUD is a copper IUD. The copper IUD can last up to 12 years. It is non-hormonal, it's non-hormonal, and it can also be used as emergency contraceptives. A lot of research has proven that the copper IUD is more effective than emergency contraceptive pills, such as the Plan B and the morning after pill. Good morning, my name is Julia Carnero, and this leads me to my research question: what are the benefits of an IUD on 21st century young women's health? The benefits I decided to study for the purposes of this presentation are the effectiveness and the lower risk of pregnancy, as well as the lesser hormonal quantity. As you can see in this graph, we have the typical use percentage and perfect use percentage of the effectiveness of the different birth control methods listed. I decided to compare the pill and the IUD. I decided to talk about the pill as the pill accounts for over 60% of birth control method prescriptions. As you can see, the perfect use percentage for the pill is over 99%, as the typical use percentage of effectiveness is 91. This 8% difference is due to the effort of having to take the medicine every day. Not taking your medicine can lead you to lose the protection against pregnancy. This 8% decrease is also why the pregnancy risks in the pill is higher than the IUD at 8%. 8% a year, as the IUD is less than 1%. Also, as you can see, the typical use percent effectiveness and the perfect use percent effectiveness are the same. This is due, as I mentioned earlier, to the IUD being an LARC. Okay, this brings me to my next benefit, which is the hormonal quantity. As I mentioned previously, the copper IUD has no hormones, making it the only type of female birth control to have no hormones, to be non-hormonal. The hormonal IUD, as I mentioned previously, the three different types that I decided to discuss are the Skyla, the Kyleena, and the Mirena. The Skyla has 13.5 milligrams of levonorgestrel, which equates to 14% micrograms a day being released daily for the 3 years that it's placed. The Kyleena is inserted into the female body with 19.5 milligrams of levonorgestrel, and it's in there for about 5 years. Throughout those 5 years, about 17 micrograms are released daily. And the Mirena, which is the IUD with the most amount of levonorgestrel compared to all other types, is inserted with 52 milligrams of levonorgestrel, and it releases about 20 micrograms a day. Even though it is the IUD with which it also lasts up to 5 years. Even though it is the IUD with the most amount of levonorgestrel, releasing 20 micrograms a day, it is still it's over half of less of what the birth control pill releases. The birth control pill I decided to discuss is a combination pill. The combination pill is made up of estrogen and progestin about a fair amount. So one pill has 50 micrograms of estrogen. They call it estrogen as the base of the medicine is estrogen, and it is laced with progestin sequences. So when you take the pill daily, it is released straight into your bloodstream, affecting all systems of your body. And this is the reason why so many women complain about birth control symptoms, as gaining weight and mood swings. With the hormonal IUD, since it's inserted into your uterus, for it to get into your bloodstream, it has to pass uterine lining. And it has been proven that less than 1 picogram a milliliter is released into the bloodstream, causing it to have no symptoms. My limitations. I chose to discuss the previous types of IUDs and its long-lasting effects. So, the IUD got introduced into the United States during the 1940s to the 1960s. The first few types have caused a lot of pelvic inflammation, as well as caused a lot of women to be infertile after they take out the IUD. After this, on our generation, the IUD has become way better, as there's many types, and none of them have proven any of those things. As soon as you take the IUD out, you're completely fertile and back to normal. And the long-lasting effects. As I decided to focus on young women, the long-lasting side effects are scary because it's a device going into your body. And how this is placed is by a pelvic exam. This scares many young women and steers them away from choosing to go to the IUD. But it also scares them since it could be used for up to 12 years. The counterclaim to this point is that the IUD can be taken out at any time, and the whole process is less than 5 minutes. Oh, this is my work cited. Thank you. Do you have any questions?
Yeah, first question. What evidence did you gather that you didn't use, and then why didn't you use it?
So in the beginning of my research, I wasn't sure what specifically I wanted to research, like what age group I wanted to focus on. So I studied a lot about birth control and how it affected women that were reaching menopause. And I didn't use that in my research, as I changed my research question to young women.
And what advice would you have for other researchers who consider this topic in the future?
So, if someone else decided to approach this topic, I would recommend them to also look further into birth control pills and all the different types, as of course I chose to discuss the estrogen and the progesterone, but there's multiple different birth control pills which only have one hormone opposed to both.